Hello, my name is Kate, and I'm your youth peer educator. This video in the sexually transmitted bloodborne infection series will cover herpes simplex virus, or HSV. As a quick checklist, after this video you should be able to answer the following questions. What is HSV and what does it do? How do you get it? What are the common signs and symptoms? How is it tested? Is there a cure? How is it prevented? Let's start with question 1. What is HSV and what does it do? HSV is a common viral infection that affects those with a vagina more often. This STBBI causes herpes on various parts of the body, most commonly on the mouth and genitals. HSV can be inactive or dormant after the initial infection. Then it reactivates several times a year. There are two types of HSV, and they differ based on the location on the body that they affect. HSV1 usually occurs around the lips and mouth, while HSV2 typically affects the genital area, called genital herpes. Both of these types can be passed on to other areas with oral sex. Now for question 2, how do you get HSV? HSV is transmissible through skin-to-skin contact. This includes oral, vaginal, and anal sex. Additionally, the infection can be passed from a pregnant individual to their baby. It is important to note that HSV can be passed from one individual to another when there are no symptoms present. Question 3. What are the signs and symptoms of HSV? Signs and symptoms can include painful blisters or sores around the mouth or genital area. Many have no symptoms but can still infect others. Additionally, recurrent episodes can occur several times a year. Question 4. How do you get tested for HSV? See your healthcare provider if you have any of the symptoms of HSV.
The testing will include swabbing of blisters and sores.
Next is question 5. Is there a cure? There is no cure for HSV infection. Long life infections will go dormant with recurrent outbreaks several times a year. Medications can prevent outbreaks and reduce how long an outbreak will last. And lastly, question 6. How can HSV be prevented? There are numerous ways in which HSV can be prevented. Firstly, you can abstain from sex, especially when you have an active outbreak. Next, through correct and consistent use of a condom or dental dams for sex as long as skin lesions are covered. There's also medication that can be taken to decrease the risk of passing it on when there are no symptoms present. Additionally, testing for other STBBIs, such as HIV, is very important, as genital herpes can increase the risk of getting and giving HIV infection. The production of this video has been made possible through financial contribution from the Public Health Agency of Canada. Thanks for watching. More information on where to get tested in Canada can be found in the description.